Me mamu akwaba eba health matters jumedie so as usual higher bia ye twetwe apomuden ho enkomo na yesua enwoma bebre e de boa ya apomuden enden so ye wa ha se ye beka adefufuro bi kra e ho enkomo ade a yato ni din se ultrasound scanning na ye ni scan we've all heard of it but ende ye bodom esuko na ye hu what goes into scanning, what it does, and a whole lot. It's Sanya Debia, and ya na yabetna hiding common yade a doctors akukudam na yade or more ever ha. But one funny and then I think coincidental thing is that your doctor say your second doctor coming here today, so at a grant. But the full name Mr. Kojo Grant. Enti kame hona yam welcome doctor. Doctor, yamawakwaba, eba health matters.
Yeah. Nimbre so ho ayefe na bichia etiefuo ne ahwefo nyina enso
omojo so that's the past say your tone suffer or with me by but when you say your previous doctor knows your friend of grants also the doctor grant so I think this is really a coincidence but
it's not more of a coincidence but I want to say that the grants we are excelling the name itself
and the next baby my friend Grantina because of your bar it's my friend
that's
Grantina.
interesting.
Oh, thank you very much for honoring our invitation.
You're welcome.
But I think the ultrasound department.
Yes.
And then the artist scan. We want to know more about scan. What is ultrasound scanning? But before you give us an answer, Mame, Enkobo Yabuafo, Edin Yantu Omun Krase, yeah, recognize your when we got here. Eti and then so ya waha ya wo aboafo ekukudam mienu bi a omo so ya sinma ya de dwumadie yi etimi e de bre etiefo ne ahwefo ba ko edi kan eye Eden Block Factory. Eden Block Factory says that factory me kan ho asem a I think say your time be bring na be ko but wo per quality blogger and they just contact them 0535-961-807 and I say 0243-964-264. Na sa wope entire so a edimu mean it ladies and gentlemen wope sneakers, wope bags, wope cap, wope hat, anything na fashionable. Wo di siesie ho a ema wo dance wo ye fe ne quality ne bibia edimu ane bo so esan wo form dia and ye for we share fly trends collection omo so betimi afre omo e wo 0278-964-820 0278-964-820 now so kwaje watare kama we come back to doctor Yesama Akwaba biom eba ha okay. Doctor, where your question now you beside and say what is ultrasound scanning?
Okay, so ultrasound scanning, you see machines, AMFD, and you share nipedia aqua nubi. I am for you physically on the body, but they are internal organs. And senya a dino sound and ultrasound is the emission of ultrasonic sound waves.
Okay.
To view a real time the emission of ultrasonic sound waves to have a view of the internal organs in a real time vision. And machine no you design in a way say e convert electrical energy into an ultrasonic sound waves and as I convert sound waves back to electrical energy of which you be able to see the images in there. And anytime I share that the way by so ultrasound is simply an emission of ultrasonic sound waves into the human system to give us a real-time image of the internal organs. That is ultrasound. And it's in a way so.
Okay.
This is part of the machine I refer the probe or the transducer. And known as a magic, and they convert the electrical energy into the ultrasonic sound waves, which is emitted through this area into the human system, then a reflection on any tissue or organ and assign back to this and a machine are converted into a real-time image of which we see. The ultrasound no ejuma no you see sound waves they share the padia aqua a what inside na yemfa ye nehu physically no That is what ultrasound is.
Thank you very much. We appreciate the explanation. The long and short of what doctor said, me say, omode machine no, efa ye honam n'ani using light. Na etimi atwe. I don't know how that magic works, but then deɛ no ɔde nam yɛ skin no, yɛ body n'ani no, ɛma ohun dia ɛwɔ yɛ nipadua no mu. Nneɛma a yɛntumi fa yɛ ni hu because sɛ wopɛ sɛ ho biribi wɔ wo body no mu a, wotumi ntwa ɛhɔ no expose the internal organ. Nti wei no machine no ɛna ɛbɛyi yɛ mu nneɛma no aba abɔnten. Yɛbɛhwɛ wɔ TV so. TV so na doctor meboa. Ɛbɛpie wɔ TV so na wahyɛ na wahu sɛ this is what is going on inside your body. Okay, so we go back to doctor. Doctor, and next question is who does this work? Obia betimi asori me te ha ya me te ha na so me wa ha me so metimi aye. Let me just move into the laboratory na me koye sa ejuma no na say ye wo specific people are omoya say ejuma who actually does that work.
Okay, no that's it. So obia oye sa ejuma no ye friend no sonographer.
Okay.
And your categories bi nso yɛ from radiographers.
Okay.
Radiographers ne ɔmo combine x-ray ne CT scan ne scan ne adeɛ nyinaa. And yɛwɔ sonographers who are purposely trained for the scan only.
Okay.
So it's either a sonographer or a radiographer. We call hɔnom a ɔmo betumi ayɛ scan ama. But sɛnea wote ha yi a ɔho ayɛ fɛ yi, wokɔgyina machine n'akyi na wode wei si nipa kɔ ne wohu biribi amfa. Mehu ne black and white. So we have professionals who does some of these jobs.
Thank you very much. Dr. Mayati, as you said, the key word is professionals. It means anybody at all can't just wake up and say, I want to be an ultrasound scanner. And I say a sonographer. Am I correct?
That is a sonographer.
Okay, thank you very much. And see, you need to be professional. So, person who just scanner, who go school, now I go see who nimidie, now when you have understanding and insight to come and do the work. Alright, so there are who say your professionals na ye adwuma die and your doctor ye bebusa say who can go in for ultrasound. I mean like enipa ko ben like why na betimi a walk in say me person be scan and say obi a betimi anante a wo ba patron person be scan and now say like it's saying why na betimi a walk in.
So ye kan obi a obetumi abeye scanner. We have no limits.
Okay.
Obia betumi abeye scan. Right from infants, a month born, a day born, 2 weeks born, till the aged.
Okay.
Obia betumi abeye scan. And one thing is it doesn't have any side effects because it's purposely meant for obstetrics and other abdominal procedures. Into any side effects bia. Into obia betumi abeye ultrasound, depending on your condition. And as a bia so prescriber and now doctor na okohu no epe yefunu no mu a nneɛma bi nkɔ yie na ɔpɛ sɛ ohu a obetumi a request ama nti everybody can do an ultrasound.
Thank you very much, Doctor, for explanation. But me was slight question be am person me put it. Who can say or prescriber and as a doctor e can say so if I said she me like I'm not sick. I haven't been to the hospital, but then I am curious about your internal organs, no? Because like I said, my son growing up as a kid, now I thought that you were this corn miller, some machine be now within your brony be see a yamwa a grind whatever we eat.
Wow.
So if you are growing up, no, that was what I had in mind. But many year drew baby, me who say enter but curiosity me person me who what goes into it. Can I just walk in say patron person me better scan, better me system me.
Yes. A lot of clients they are working their personal requests. They are won't feel so baby or yare and but you just want to know how your internal organs are doing, whether there are pathologies and now say condition be a developing. What signs and symptoms here. You can just walk in, then we'll do the procedure for you. Can check on your liver, kidneys, spleen, pancreas. When it comes to the fertility stuff, we do the uterus, the ovaries, to see if there are infections or stuff. A whole lot of things. So anybody can walk in. And for the men, You can also walk in to check on your prostate, your kidneys. You can also do an abdominal scan to check on your liver and stuff. Bi wɔ hɔnom a na yɛ lifestyle ɛma yɛnya some conditions bi wɔ hɔnom a yɛnnim sɛ yɛnya, such as hepatic conditions. Bi wɔ hɔ na ne liver ɛyɛ kɛseɛ ɛnam nsa ne smoking ne adeɛ, of which a ɔnnim. Nti wobɛtumi awalk in just to do a scan, then we'll be able to see some of these conditions which are developing. So anyone at all can walk in for a scan.
Okay, thank you, doctor, for the explanation. Dr. Mayatia says anybody at all can walk in for scan. Sometimes don't say your conditions being part nim and you might be air cost when you pay. So I think that, doctor, let me just bring this one. I think that randomly, like ABL makes a while 6 months. Let me just go and check on my liver. Let me go and check on my prostate. Let me go and check on this thing I don't see visually with my clear eyes. And me who me show me, oh maybe I'm in swelling, I'm who so me no swelling. But if there was something wrong with my liver, my kidneys and all of that, I wouldn't know. So I think it's advisable, sir, maybe at least by yearly and make me a walking semi bed scanning system. Is that okay?
Yes. Those are times within our setting, we are not health conscious.
Yeah.
Yeah, we health professionals now and at times we'll be in our facilities for a whole year and check up. Someone foresee a crown so not talking of our environs, those who are naive, advisable send our work and say every 6 months or 6 months. I think 6 months is enough.
Yeah.
Every 6 months you can just go in for a checkup, either at the lab or the scan. Na yɛahwɛ sɛnea our system no ɛrekɔ sɛ how bi ahyɛ aseɛ develop a, the earlier the better. Then yɛama wo prescriber na wahwɛ na watu ho anammɔn so that ɛnkɔyɛ worse. There has been some instances ebi wɔ hɔ ɔbɛtena hɔ nom a ɔsɛ me deɛ for the past 5 years menkɔ hospital da.
For the past
a whole lot of them. Yes. Me deɛ menyare o for the past 3 years menkɔ hospital da. And they will come in for a scan and answer lab. And to their surprise, there will be a condition of which maybe some stage you shouldn't have gotten to that. Nti a woman, we should be health conscious, visit the facilities, you see the personnel involved or the in charges. Then when your mark person may check up. I want to see whatever is going on in there. Then whatever is there, we just let you know. Then the necessary steps to take, the better direct. So then you take the necessary steps.
Thank you very much. Thank you. I think the program where you say, oh, you should get your pen and then your paper. You jot down vital informations, and then when you pick up your phone, you Google more, you read more, and then you know more about your health. We appreciate you so much, doctor. Okay, since anybody at all can walk in, when I walk in, what should I expect?
Okay, so when you go to a scan room, first of all, you meet a professional, a sonographer. If you haven't seen any doctor, one person scan, you can talk to the professionals, your condition, the reason why you want to do it. If it's a general checkup, you speak to them and they will help you do it. And most of the times, because you'll be exposing some parts of your body, we ensure privacy is assured. The procedure, you see a professional, or no bekasa, take your history, then you lie on the bed, of which we will be applying this and a gel on your tummy. So we need the bed procedure.
Time and to say experiment.
Nanka we who send ya procedure ni na etie.
Doctor da ye dia da kwa se me twomba wadwuma ho na me be ye bi. Ya me ye o anya se me be show.
Wow baba be.
Me be ye o be kire me na ma ye.
So
me ye o me ho me de ye obi.
Okay, no problem.
I want to have an experience.
And by Abia, we lucky by the time about clients for hope.
Na me use you. It's a young church we say me be here.
You may not be denying. And
yeah, you'll be crying the obi baba. And one thing is,
Anytime you are doing a procedure,
Yeah, but checking the prostate.
very necessary. So anytime we'll be doing the procedure, we would have to be communicating with the
Okay.
client, and I will say client me who whatever it's happening.
Okay.
Nti bedi nkan akyerɛkyerɛ no mu. Oh, ade a wɔbɛyɛ no sei na yɛbɛyɛ no, sei na ɛte. Ɛnyɛ ya, wobɛda hɔ, yɛde adeɛ bɛfefa wo yɛfunu so. Wie a nea ɛwɔ hɔ biara no, find a nice way of communicating the findings to the patient. Sɛ doctor nso na request a about the same process now no be go through. You explain procedure, you lie down, you do the procedure, you yeah, whatever findings, we might disclose it or not to the client.
But why?
Then I make as a doctor and a request here. We have reasons for that. We are the better report amount and I say best send the report to a doctor no. Who doctor and your hobby or no becca. But at times disclosure of findings, yeah, been send me back in quotes. Some of the professionals, the way I know Becca Sano, you came in with one kasa oba na why confused dada because ya kasa koye scan wonnim nia e how nti oba na why confused dada and we ye no senia obe disclose the findings natural will make it worse.
Okay.
So at times when we see certain conditions which are kind of disturbing,
conditions
we are fan say nipa kro no alcoholic and so therefore it has affected the liver in a way. We have ascites, obi a ɔhwehwɛ ɛba maybe ɔbɛba na the uterus is being occupied by a fibroid or other ovarian conditions.
Okay.
So you read the person, you speak to the person, what are the psychological states, the emotions before you disclose the report.
Okay.
You also disclose it in order for the client to be at peace.
Okay.
The Bekasa will reassure you, then we'll give the report to you to give to the doctor. The local doctor, they have psychologists around, they have counselors around. The doctor will also find a professional way of disclosing it.
Thank you so much, Doctor. Like this fibroid. I think one of these days we call you or any doctor and then we talk about fibroid because one of the disturbing fertility problems to our women out there. People think say a menstrual disorder and a fibroid and then but I think my interactions with someone who say fibroid is basically like cancer because the cause is unknown. But I think this is just by the way. We will find a better time and then we'll talk about it. I know we've talked about this already, but I still want you to talk more about it. When? How often should we walk in for scan?
Okay. So with the how often, if you have an underlying health condition of which we are monitoring, the prescriber will give you the intervals. If they are on what to withdraw, so or a hepatic condition, a liver condition, and now say our kidney stones, and now pyelonephritis, of which I know what to withdraw, so I am monitor for some time. Doctor Nebeka chose if they are offer a journey we are 2 weeks time and now 1 month's time to just scan. Na yɛnhwɛ sɛ condition no improve anaasɛ it's getting worse. Ɛna yɛwɔ those who are treating for infertility. Ebi yɛ ne wato hormonal drugs so the doctor wants to see the progress of your reproductive system as to whether you are ovulating, whether you are having mature follicles or stuff. And then so doctor betumi a request on monthly basis. Say this month we a draw we are or yes scan share the size of the follicles as to whether it's maturing or it's still the same. No, we hit the next step of action. And I and collar do also one at birth or the iron leaky jaundice, you want to rule out any hepatic conditions, they can also put you on scan. But the intervals, it depends on your condition.
Okay.
But if you don't have any underlying health condition, that one 6 months, you can come for a checkup. While we scan out between for them, so at 3 months, that's whereby you are being health conscious.
Yeah.
Every 3 months, you can just go in so that if there is any development, any new development, we'll pick it as soon as possible. Then the necessary steps will be taken.
All right. Thank you very much. Doctor say we should be health conscious. We Africans and Kasano, we aren't health conscious at all. You see people saying say 5 years near me call hospital that me 3 years near me real me. Now me they share me body no. And then you'll be surprised that those people they go to the hospital and then they have serious conditions they have no idea about. And yenye health conscious. Now, doctor say your underlying conditions be if you are under treatment, and no, it depends on time. Yeah, doctor, and I say whoever is in charge of our health, no, ebe mayen. Unless that no yearly 6 months, yearly cry a 6 months. Every 6 months, that is half a year, you should just go in for scan. And I say, being so consciously about your health, you should be there every 3 months, which is quarterly year. Every first and then whatever quarter of the year, you should be there. Okay, we move to our next question, doctor. Mpɛ bebree na yɛ nkurɔfoɔ ka sɛ X-ray ɛwɔ side effects.
Yeah.
Side effects, especially for pregnant women, because before this program, I think most of us in say obi nyemwa and no scan. But and the one my yati say enye de onyem nko a no scan. Enti apart from say X-ray war you can say side effects or pregnant women, and it could have on anybody at all who moves into the room, or and I would deem it different, it's just a room, right? And see the scanning also has this side effect because obi wo or say 3 months be am scan there fa how me 6 months be am there ha me and like doesn't have any side effect.
Okay, so with the side effects, I would say no, it's safe. It's totally safe because the manufacturers, and now say machine, the physics behind it, they considered the newborns or the embryos. And the emission of sound wave doesn't have any side effects, and the sound wave is so high to the extent that the human ear cannot even pick it. So it doesn't have any side effects as compared to the X-ray. With the X-ray, you have the radiations in there, and because of the embryos or the fetus, they made it so safe to the extent that it doesn't have any side effects as compared to the X-ray and the other investigation machines. So with the X-rays, for instance, when you are too much exposed to it as a pregnant woman, within your first trimester, it's likely they're having some deformities here and there. And an X-ray no nso yɛ dumfo kumfo. It can give you radiational conditions, and it can also heal you, especially those who have cancers. You have the radiation therapy. The radiation corona, but the higher one, they fight against cancer and stuff. But for the scan, it's totally safe. Maybe you might get some slight discomfort after the procedure or during the procedure. That is whereby you might feeling some lower abdominal pains because of the application of the probe. At times, due to the skin thickness of some clients, you would have to press hard. Some of them to have lighter skins. You would see so and you want so the pelvic organ no, it's down within the suprapubic. So especially within the early pregnancies, you have to press down to the suprapubic before you get them. And at times they complain of minor lower abdominal pains, and within a day or two it's gone.
Thank you very much for this one too. I think Doctor Amaye explanations bebree. Sisi a wama yate ase say any side effects bia even say dey bia kwa be kwa kocha scan po a emma problem bia. Enti yen take note na we should be conscious of our health. Na yen take your scan very serious. Enya pregnant woman ko an kocha scan. Enye obi a doctor aka chen so kocha scan nko a wa kwa betimi akocha scan untimi ready and obetwa ma no obetimi ready aka de wom e de akyerɛw. Okay doctor, I think say your final question I be busa on say enyoma bi wɔ hɔ no mo a scan ebetimi detect like yareɛ bi deformities bi ni adeɛ wɔ hɔ no mo a when I go in for scan it can detect that this is the problem.
Okay. So that is what the machine is meant for.
Okay.
The scan to detect abnormalities or to pick any abnormal growth going on internally. Nti woba na yɛhwɛ wɔ liver, maybe there are liver abscess, liver lobes, hepatic cyst, there are a lot of conditions. Woba na yɛhwɛ liver na yɛbɛhu sɛ bi a ɛhaw bi wɔ ho. Yɛbɛhwɛ wɔ kidneys, whether there are kidney stones, whether there are pyelonephritis, then also bad, you just look at those things. The measure was spleen, actually gallbladder, whether it's cholecystitis, cholelithiasis, and also bad, you look at the bowels itself, whether they are dilated, whether there are fluids in the peritoneum, look at the uterus, the ovaries. The measure in to say how be or one, you can easily pick them up. So conditions as can pick they are numerous. A dorsal ascites, a whole lot of them, a whole lot of them. And with the males, and then so when it comes to the urinary system, we look at the kidneys, and most of the time with the males, the kidneys and the bladder works in hand. And if say nipa korɔ no anya urine retention and now say urinary obstruction and now prostate enlargement for quite long, it tends to affect the kidneys as well. Nti obi baa na so mpɛ sɛ me check me kidneys mehu me dwu nso me yie me dwu nso a ɛmba me dwu nso a ɛtwitwa sisi me dwu nso a ɛba bebree me dwu nso ntoatoa so. We just look at the prostate. If it's enlarged, if it's not enlarged, we look at your kidneys. Then we'll take your history, whether you are diabetic or not, and also by where to handle your issue from. Nti with the cases and I say conditions are stand between detected they are numerous. Bebree.
Thank you so much, Doctor. And then I think this program, no, so you are missing a lot. You are really missing a lot. If you are not joining the Health Matters program, you are missing a lot because and you might be what you happen now, Betty. Ɛyɛ ha pɛ ɛna wobɛte wei nsɛm bi wɔ hɔ a ɔka kyerɛ yɛn a ɛyɛ n'adwuma mu nsɛm. You should be in the job, in the field before you get to know some things, but then you get to hear it free ɛwɔ platform wei so. Eti doctor, there were some questions bi wɔ hɔnom I would like to ask. Yeah, like most at times nkɔfoɔ a ɔmo ba mo nkyɛn no yareɛ ban paa the commonest diseases ɛyɛ a motumi discover in mo scanning no ebi yɛ den because yɛn nyinaa nka yɛnim sɛ most of nkurɔfoɔ out there ɛnim sɛ scan deɛ nka yɛ pregnant women obi koraa nim sɛ bɛrima twa scan. If not for today anka meyɛ sure sɛ obi koraa nte da sɛ bɛrima etumi twa scan. So what are some of the conditions a motumi finding out your findings and scan? I think wayɛ adwuma wei akyɛ.
Yeah.
So the commonest conditions. Yeah.
Okay. So when it comes to the conditions, I'll start with the females. Your hormone most of the clients lay obstetrics, a painful no more, then followed by a painful the normal ladies who comes for checkup. And aside a painful no, when it comes to the normal ladies who comes for checkup, the commonest condition will be having is the uterine fibroids and no na common. Initially, the age range was from 30s upwards, but now saying it looks like the youth are getting it more.
Oh wow.
20s, 20, 24, 25, 28, omunya fibroids
Really?
of late. It was initially 30, late 30s, 40s, and now we say we have fibroid. Now, so now it's common. But of late, I think our lifestyle and other stuffs, they are making the youth get them more. And there were other conditions like the fibroadenomas.
Okay.
We do a scan of the breast as well.
Okay.
Nti yɛhwɛ breast no nso a ɛno nso ɛyɛ common. It's more or less like fibroid in the breast. At times it becomes there are cystic collections of fluid within the breast, and I have mastitis and other stuff. And also the second most common. Then we have the PIDs, the pelvic inflammatory diseases, where the pelvic region will be inflamed due to infections like gonorrhea, syphilis, and the rest. And also EBA. Then we have the ovarian conditions, such as the ovarian cysts, ovarian mass, hepatic and hemorrhagic cysts, and the rest. And also EBA. ɛna yɛba mbɛrima no nso a sɛ mmarima deɛ a kampe a ɛho sɛ yɛho ɔden ɛho ahomte nti yɛn no yɛntaa nkɔ hospital nti yɛ conditions no nyinaa nso yɛ worse when wobɛto sɛ bɛrima da hospital na waboto a wohu sɛ no yareɛ no ɛtumi no nti mmarima no most of our conditions no ɛyɛ hepatic conditions, the liver, and obeba no na it's either you'll be having a hepatomegaly, liver cirrhosis, ascites, and one thing is to say oyare ahyese no, it could be from hepatitis B or other related conditions. Oyare ahyese na instead of saying obeba hospital na yahwe no no omba ebehye bibiduro yanom ebekọ prayer camp yabɔ mpaeɛ ama yɛn foda waters saa nti yɛde no bɛba hospital
I think
nyankopɔn bɔ yɛ special.
No, this is not about speciality and then must be a day like some years that will be like
so
I don't get you guys.
That is the nature of man.
Oh no,
that is the nature of man. We don't easily accept certain things ɛna yɛhu sɛ yɛho yɛ den nti you would have a hospital.
No, but I think more education should reach the men.
It is very true.
I remember saying, Madam could be never pause a day in this prostate cancer. My share no Kumasi G or say whatsoever. And then looking at a man or dawa ontimiya she and money. When this and then funny enough, when that thing started the children were like, they are young hospital. When they went to hospital, before he realized he was at the verge of death. And then they drove free, I think UK. The drug didn't even get to Ghana and then the man died.
Wow.
So, you see, it's so sad. So I think more education should reach.
We will advise our men, our fellow brothers, our children, our fathers.
We should advise them. More
we advise ourselves. We advise ourselves.
What was me? Sure, I was scanning.
Sister,
it's so bad.
We will advise ourselves now as and when we can go for checkup. Women are very conscious of their health.
Because they say you couldn't be
simple. I just want to say the higher a woman will go, but for a man, I just say I cannot to hold.
Yes, and it's not good.
Very bad.
It's not good. All jokes aside,
our health, our lifestyle also depicts because I am no sebe yanom nsakakra yedidim any idea, and some of these things they have an implication on our health. We will be working all day, forgetting to eat. Your consua, and this is more mukase. Or yet, and finding one I cannot know. I shall be the other way. No, I mean, the men, it's not like that. We would have to be conscious of our health. We would have to visit the health facilities for checkups. Na yɛnhwɛ yɛapɔmuden because yɛnso yɛnkwa hia nti sɛ wahwɛ a statistically mbaa dɔɔso sen mmarima no nso wu sen mmaa it's because of some of these health conditions bi a ɛnni sɛ nka ɛku wo no yɛbɛtena hɔ a yɛhwɛ hann yɛbɛkɔ na ayɛ too late then we'll be gone too soon. So my fellow men, this advice goes to us. You should be health conscious. You should be visiting the health facilities for lab tests, for scanning, just to know how we are doing. Now, advice and medications be the doctors, any before and share now among family so that between at Senasi now you win die no Emma Binum so that it's never no move away.
Oh, that be I rebuke that in Jesus' name.
We all live till eternity.
Yes.
We all live till eternity.
We die at the good old age.
We share good memories.
Yeah. Thank you very much, Doctor. Doctor, I think that we will still need you here on our platform some weeks to come because Yarebi Awubodino, I would like us and I would be glad to say a bit and come so that we educate the general public and then we all know what we should do to help our health. Okay, so Doctor, I want to ask this question. Say, do people have misconceptions and come forward to report be and your be and can you say about you misconceptions about scanning?
Yes.
Okay.
So to every point there are two sides.
Yeah.
Nti Obeka papa no ebenya bone nso wo ho.
Sure.
But it should be that the bad side should be minimal.
Yeah.
And we can have the human error, we can have the machine error as well.
Okay.
For instance, there are perceptions like, oh, I went for a scan, the sonographer told me I'll give birth to a female, but I give birth to a male. So therefore, I don't believe in scans. Those perceptions are there. But as you know, we are human beings, we are not God, and we are working with machines.
Yeah.
So the human error is there, the machine error is there. If we don't use the right or the appropriate tool for the appropriate job, we end up having a deviation. And the professional doing the job as well. And then so at times our experience and other things also count. Nti sɛ nipa korɔ no bi a nyɛ sɛ wɔfa mfikyire hɔ yi a wakɔto so obi de machine esi hɔ wokɔɛ wakeka bi akyerɛ wo ɛhyɛ wo tirim sɛ bi a mekɔɛ scan na sisei ne sei ne sei, so therefore I wouldn't go. You can seek for a second opinion. Nti sɛ woba me hɔ meka kyerɛ wo sɛ scan no sɛ ɛyɛ bɛrima, you can seek for a second opinion or a third opinion. Kotwa wo baby foforɔ anaa baby mmienu a ɛyɛ recognized, either a hospital and a recognized diagnostic center. Na ɔmo nso confirm for you know na at that particular time na nipa korɔ no yɛ no psychologically the person wasn't that stable. Na during the baby human error is there, machine error could be there. So ma yɛmfa nipa baako ɛmfom soɔ ɛnsan ne nyinaa. Nti sɛ woba ha na if you are not convinced with the services being rendered, you can go to a higher facility or seek for a second opinion just to clear your doubts. Because scan ne deɛ here.
All right, thank you very much. We appreciate this explanation. But doctor, on a scale of 10, how often does we have the wrong reading, as in being it the human error or the machine error?
Okay, so on the scale of 10, I would say how often do we get the human error?
Yeah.
Okay, so on the scale of 10,
both human and then machine error.
On the scale of 10, I would say only 2.
So, oh, then I think there shouldn't be any misconception. Thank you, doctor, because 2 out of 10 is a minimum, like the least of it.
The least of it.
And Timmy Pacha, what we just kind of damn, I can show so we know what could the job already made near idea, but a buy and we are sorry, and I stand with doctor. And then I apologize. It could be human error, it could be machine error. A machine with me a Joanna wa bread, and tia na mafanisa, na mwenya botre, ya susuton tadian so nesa womb for baby. Thank you for being with us. Yeah, that's a February. But Shanice said, me I did you made a growing. Your friend me if you are Daisy. Papa be your baston or papa be me papa good dear, me papa papa be your baston or be saying I'm okay, so your sponsor saw ya say my did you made a bread no Eden Block Factory. My can't be I don't want to say much. On my number 0535 961 807 and now says 0243 964 264. That's the open Tarian Swa, a dimu, air quality nano ball from Swa, and a fly trend collection. Almost one number 0278 964 820. Yadama say, Samunya Brain, I'm with the shame. Kai sell best subscribe your YouTube channel, our Jehovah Nisi TV, our YouTube. Now I follow Health Matters, our TikTok. Now, and that's so. Yɛbɛsɛ hyia biom next week ɛwɔ ha. Meda ase makra mo.